panelist, Ms. Deepthi Ravula, CEO, Hub Moderator, to please come on to the dais. Dr. Viswanadham Duppatla, AVP, Head Life Science Incubation, IKP Knowledge Park, to please come on the dais. Dr. Renu John, Professor, Department of Biomedical Engineering, Head and Founder Director, Center for Healthcare Entrepreneurship, IIT Hyderabad, to please come on dais. I request everyone to please have a round of applause for all of them. May I now invite Dr. Ramjee Pallela, Chief Operating Officer, Atal Incubation Center of CCMB Hyderabad, to please come onto the dais. Also, Mr. Prashant Sinha, Head Technology Business Incubator at Pilani Hyderabad campus, to please come onto the dais. And the topic of discussion would be role of incubation centers and accelerators in digital healthcare.
Everyone, how are you guys doing on a Sunday morning-ish thing? It's quite early for Sunday, but it's really amazing to see all you guys here. So we're going to have a conversation today about the role of incubators in accelerating innovation in digital healthcare. So I'm extremely thrilled to be here, to be honest. I've only been here for the past 1 hour, and the kind of conversations that are happening have really opened my eyes, because I'm really not from the sector, but I work with a lot of healthcare startups, given I head VHub, and I work with a lot of women innovators in this area. So it was really nice to hear so much about it. And I'm extremely thrilled also to be amongst colleagues that I've been working with quite some time, and I've never had a chance to actually publicly ask questions, so I'm really thrilled for that option as well. So thrilled to be joined by Ramjee, Visu, Dr. John, and also Prashant. So the format is going to be, there'll be 4 questions, which will be open for all, open for the panelists, and we'll get their insights, and then we'll actually have a lot of questions from the audience, because I'm hoping that there are some innovators in the audience, and this is your chance, guys, to ask all of us questions and make sure that, we all come together to take you guys forward. All right? So we'll start with, not that many of all our panelists need introduction, but I'll make a small attempt. So we are joined here by Mr. Dr. Ramjee Pallela. Ramjee is the CEO of AIC-CCMB. Then we are joined by Dr. Visu. Visu is the CEO, AVP of IKP. For me, Visu is a man, he's the one man who can actually mobilize everything, so he does everything for us. Dr. Renu John, also the head, he handles all the Center for Health at IIT Hyderabad. And Prashant Sinha, the man who needs no introduction, the head of everything at Pilani Incubation Center. So to start out with, Ramjee Garu, there's a lot of conversations around digital healthcare. The government has been doing a lot. At least the Telangana government has been taking a lot of wonderful initiatives. There is a lot of Basti Davakhanas which are all digitally enabled. We have a lot of new initiatives which are actually early disease detection centers which are being set up in every hospital of the state. Then we have palliative care centers. There is a lot of emphasis on health. And we also have a recent new minister who's actually come on board, Mr. Harish Rao has just been appointed. So what does digital healthcare actually mean for somebody like me? What does digital healthcare?
Yeah, you need to start abbreviating from your side as a moderator, but anyway. So our perspective of digital healthcare as an incubator perspective, I can tell that we look into different areas in the digital healthcare domain, be it patients' accessibility digitally to take care of their health. Okay, be it a device or a diagnostic device or a kit, how it is integrated to a kind of platform where a patient and doctor can actually interact. That is what my understanding as a digital healthcare. But as there is a lot of lot many things are involved considering the digital healthcare broad domain, including records, medical records, and etc. So I think briefly to say that you can't say that okay, this is what digital interventions in healthcare, starting from the patient's ask to patients, I mean, clinicians' solution to the patient. I think that's what I can say.
Yeah, thank you. Because for me, for me, digital healthcare means everybody being an owner of their own health and getting access wherever. But once we demystify from all the experts, we'll be able to ask deeper questions. Viswanadham.
I will tell from the IKP point of view. As some of you know that we are one of the leading science park and incubator, and these problems about digital health, and during the conference we are discussing about pandemic. As incubators, we should be starting not when the problem is there, well ahead of it. I will just cite few examples. So in IKP we started MedTech Accelerator with UC Berkeley in 2017. Dozy, Muditi is here, Credible. So I think as incubators we should look at very broadly and get prepared for the future things, not reacting, but preparedness. And during the course of time we'll be happy to share some of the recent advances. Ambu sir, I think he spoke about the Deep Digital Elite Fund program, where the startups are there, and as many of you are asking about what are the funds available, so IKP has Digital Elite Health Fund headed by Ambu sir, and also Growth Labs, where the bridging of the specific problem is there. Like you're unable to raise fund for marketing, reaching to the hospitals, and establishing these demos. This is like in the range of 20 to 75 lakhs from IKP, and we also help them to onboard other co-investors. So sir has, I think, mentioned already, but I will just take an example of BrainSight, one of the early stage team who came to IKP as a BSc partner, and from there they moved on, and then as a part of the Deep team they raised 5 crores. So this kind of support we will be very happy, and we'll be discussing more with us.
Dr. John, digital healthcare and the focus from CfHE.
Yeah, so I think from a digital health perspective, it's all about shifting healthcare from a hospital-centric environment to a personnel-centric environment. So it's all about, say, electronic. It starts with electronic medical records, telemedicine aspects, teleconsultancy, and connected systems, which could enable the patient to have their health data at their fingertip. And finally, the end of all, probably, like all of us are looking at how say artificial intelligence and machine learning aspects are going to deliver the best decisions, so that it can prevent or plan your healthcare delivered right away to you. So I think that's sort of the view I keep it.
So I'll give a bit of flavor of. I'm incubation center based out at a engineering college. So I see digital healthcare right from starting with data analytics, till diagnostic, as Ramjee said, till means like the changing from tertiary to electronic, from sensors, artificial intelligence, and there are n number. Digital health, actually, when we talk about, and we were discussing with Deepthi, so we say that there is a lot of amount of data which has to be democratized through the government or some policy advocacy. When I see digital, as in BITS Pilani we have 13 departments, right from humanities till physics, chemistry, chemical engineering, and most of the, so in every department I see this digital data coming up, right from IoT is one of the sectors. There would be a lot of amount of data which would be generated in future, so that would be a precursor to the amount of data which will come up. Analytics is the other part, computing is the other part, cloud computing is the other part. So it's a mixture of all that thing, and here at Public Health Expo, I see a good mix of people from different domains who have come in. So digital healthcare, digital obviously is www and an app which can be developed. But there have been, when Professor Raghu was talking today morning about the Sahayak app, so that's one way of that. He talked about how people have connected over a digital platform. He talked about a diagnosis which has happened through cuffing that was there. He talked about the artificial intelligence side of it, but in between I missed some of the points, but I see IoT playing a very important role. So some of the startup companies in the IoT space we have supported, and we look forward to support more companies. And when I say that we at BITS Hyderabad, BITS Hyderabad itself is an incubator. I don't have to acknowledge only my department. So there we are talking about sensors, MEMS sensors which can be developed, so which will be a feeder to the digital space. So that's a holistic view on my understanding towards digital health, because I see this sector maturing. There is a lot of interventions which has happened. COVID has given us immense opportunity. So, but clubbing all this together will be, we can have a sustainable model of digital healthcare. Thank you.
Thanks, Prashant. So coming back to Ramjee, now that we've established what digital healthcare means, for AIC-CCMB, which is a life sciences incubator, and you yourself being part of several consortia for innovation and also mainstreaming of these various initiatives, two questions for you. Number one, how do you feel that the national digital healthcare mission focus and also the state healthcare focus, how it actually translating through the incubation programs, and is it translating well into the startups? That is the first question. The second thing also is that as an incubator yourself, as a life science incubator, how are you actually fast tracking? Because time is the essence, as we have seen over the past 1 year, right? 2 years. So if you can.
Yeah, I think considering the first question, the past 1.5 year, we are part of AIC, for example, and I personally part of a lot of these COVID mitigation technologies, and out of whatever the 1,000 plus or 1,200 plus applications, 60-70% are related to digital healthcare. So that's where the emergence happened here, and ministries were started working together in the sense how we can actually accelerate these kind of interventions, not only for the COVID per se, but of course they started planning for next 10-20 years, how we can actually work together to address some of these solutions for a societal benefit. Okay, that is one thing. But of course, bits and pieces, we have different programs at the incubator level, then to state level, and then to national level. But I can tell a few of the how we actually emerged as a core life science, and my second answer may also mix up with this, but core life science and biopharma based incubator. When I joined in AIC-CCMB, what we realized is that incubation funding, getting the BIRAC funding for incubator, NSTDB funding for incubator, and AIM funding is already there. Again, BIRAC, BioNest, and this is not really addressing the real problems of innovators. So we have to actually address different problems with different mechanisms. That's where we increased our partnership portfolio with the governments per se. That's the first step that we have done, and that's where the MSH came into picture, Mighty Startup Hub. And even 3-4 years, we transformed a bit, and also government agencies also, they also realized that I think the startups are not looking only money and funding. So what is other than funding? That's where we, along with these funding agencies and local other collaborators and partners, were trying to, bridge those gaps so that, we can how to actually create that end-to-end based solutions by networking with all other partners locally and nationally. Okay. So the first question, one more thing about the programs thing. The TIDE program is one thing that we are doing. Of course, 4 lakhs, 7 lakhs, whatever, and again seed fund they are getting about 25-30 lakhs. But the urge to student innovators, to startups and industries here is that try to actually ask the right ask to incubators like us, or maybe the other accelerators, or even the investors. Before you go there, at least talk to us, because see, what you know is best than us, definitely, but still, when is the right time for you to actually get that particular thing that can solve your that movement problem. So that is one thing. So nationally, several other programs now are streamlined. Okay, now we may be getting sooner some of the national missions, particularly related. Of course, we have the Digital India and several other programs already implemented, and some are just initiated. But yes, some more are coming soon, maybe another 3 to 6 months also, to address each of these issues particularly, so that nationally we can actually address these digital interventions. That is one thing. Locally, I think, by connecting to IKP, or we have, so the share of these requests by the startups. Okay, I have this, I'm having this from VHub, but I want this from AIC-CCMB. So that way we are trying to actually synergize the strengths of the incubators and accelerators, and we are trying to actually direct those startups and innovators to go to the next level. So be it nationally we are able to connect, and also internationally. Some of the startups may need some of the connections even from US or Sweden, something like that. So I think, yes, we are evolving, and in the past 1.5 years is a big eye-opener for everybody. And I think we have to fast track life science, core life science based also, how we are fast tracking in the sense that we are now introducing IoT based and data analytics based interventions in genome studies and all at CCMB, for example. So our startups are using the CCMB data, and even outsiders also, if they have the right solution to address the right problem that we are having in our society, and we are facilitating through AIC-CCMB. So that way, we are trying to accelerate and leveraging CCMB facilities so that they can actually bring in the right solution. That's what I can say.
Thank you, Ramjee. That segues nicely into the question for Visu. So Visu, you have actually spoken about how you have international collaborations, right? So what are the kind of initiatives at IKP, and what are there to actually accelerate the digital healthcare focus going from local to national to international? If you can just speak about it.
Thank you. So, just mentioned about the UC Berkeley program in 2017, where very focused. So, two kind of startup requests we receive. One is we want GAN, and one is we don't want GAN, everything else. So, that's where the accelerators come into play. So, they have very specific requests. In the accelerator, we have a very broad range of requests coming, starting from somebody want to visit the hospital, somebody want to go to a diagnostic center, somebody want to interact with patient pool, somebody want a government connect. So in these programs, so during COVID time, we had a very nice board which responded very quickly with a small grant, fund, ICO fund, 5 crores. 23 startups were supported. So there was very nice support from the government. BIRAC stepped in with a 2.5 crore grant support. So when we put in as a problem statement, somebody who is going into the market within next 3 months, what is that they lack? What is the rate limiting thing they have, and where we can step in are our partners. So we have through Technology Transfer Office, IKP Prime, we have established various collaborations, and of course somebody is saying money. Certainly money is one of the very important thing. We have various collaboration with national and international players, which I just mentioned on the slide, you can see. So this is what we can bring into the startups who are part of these accelerator programs are coming to IKP. And the good thing is all these partners are also looking for teams like you. So you have to approach us with a very specific ask, and then the incubators, when within their partnership, they will be very happy to extend their support, like Ramjee is saying, if somebody wants to samples, if somebody wants a large space. So we have different incubators serving different purposes, and you can reach out to any of us. We will be very happy to connect. If not, we can directly solve that problem. we can connect you to a proper mentor or a partner who can solve the problem. So for example, Dozy during COVID time when they came, Amritsar was there directly talking to the ozone labs and everything was done within 1 hour. In a normal situation, somebody sending a mail or looking for pitching, explaining. So within 48 hours, they wanted to establish a 100-bed hospital and we could help them. And this is, I think, one of such example, and there will be several such possibilities when we know the problem statement from you. As Ramjee told, once you are very clear, you are very good with what you are doing, but if you know what you lack and what you want our help, we will be very happy to bring in our partner ecosystem and to help you from that point.
Thank you, Yusuf. Thank you. So, Dr. John, you have an AI department in IIT Hyderabad, and how much is the faculty actually involved in making more of the innovations in digital healthcare move to the newest and greatest technologies, as you were speaking about before?
From an academic perspective, I think IIT Hyderabad has been quite doing good in nurturing startups in this line, especially in digital healthcare and in activities involving artificial intelligence and machine learning aspects. So in fact, IIT Hyderabad has been one of the first IITs to come up with an AI program. So looking from an academic perspective, what I see is that we need to look at what are the gaps to be filled in the country and probably look at what is the future. So human resources is one of the main areas where IIT has been concentrating. So with more and more startups, say AI or say digital healthcare has been there in every aspect of our life. But where are we as a country at the moment? So if you compare ourselves with probably even small countries like Singapore or some of the European countries who are probably doing quite good in getting their digital health records, like Estonia or Finland or some of these countries. So we still lack some of the resources to have digital data, healthcare data records. So I mean, sometimes it is amusing to say that, you know, for India, the healthcare records still exist in the plastic bags carried by the patients. So from here to migrate to a digital platform where we have the electronic data records, and of course, then we have the connected systems, including all the vital parameters to be monitored, which would also guide us to, say, predictive analysis for diseases and for prevention of diseases and well-being. So in this journey, probably, I mean, where are we as a country? What are the main bottlenecks? So from an academic perspective, IIT Hyderabad, we should probably, and other education institutions as well, we should look at probably how do we bridge these gaps in terms of the standards. How do we get the data viable for the intelligence? How can we store the data? How can we communicate the data, transmit the data, ensuring safety and security, and with the patient at the center of the healthcare management system. So we need to work a lot on policies. Institutes and also like incubators like IKP should be leading and representing to the government in forming policies and this is one of the main enablers for many of the digital healthcare startups in the country. So it would be really a start point to create policies in this direction. Of course, there have been a lot of new policy changes, but there are many to be enabled for the. So we talk about interoperable systems. So we know that, I mean, if you enter any of the hospitals or even private or the government hospitals, you don't see the equipment talking to each other. So many of these are proprietary at the moment. How do we enable interoperability of the instruments, which is going to be one of the main challenges in having this digital healthcare enabled. So all of these should come to the picture when we talk about how do we enable the digital healthcare. And finally, the future, I would say, like, you know, it's not going to and replace a clinician. It's going to enable a physician. At the same time, we can really visualize like a digital enabled healthcare system with an AI is going to replace a health system without an AI. So I think that's where we are heading to. So that summarizes probably how the academics look at it, and probably the incubatees and incubators working in the academic domain look at it.
Thank you, Dr. John. And Prashant, following up on the academic part of the thing, how are you actually taking all these students that are part of the BITS community, and how are you actually doing work in the BITS TPI to support the startups which are in the digital healthcare domain, and how are you actually supporting these young minds? And can you also shed a little bit of light on the BioCPS program that you guys have at BITS?
So again, when I last answered, BioCPS was not on my mind, and that's very important in these days when we talk about a cyber-physical system. And earlier people used to think that cyber is something which is electronic, but we are now talking about a physical system which will actually have a tangible thing to see. Means like it's not just binary which is happening. So again, BITS got some 125 crores for biocyber physical system from Government of India. And there are a lot of startups which are getting benefited. There is a startup which was incubated with us. They have made a diagnostic kit for antibiotic resistance, and that's a generally, I'm sure most of you would know that antibiotic resistance sensitivity test happens in 48 to 72 hours. So our startup at she is a faculty startup. Faculty and Dean for International Affairs. So she had a startup, she got a President Award for it, and she's trying to commercialize that product. And coming to what we were talking about, how we mobilize BITS community. BITS community, again, we are not just for BITS, we want to develop an ecosystem. Anybody from any students, anybody across the world who wants to utilize our infrastructure, we are open to everybody. Well, we regularly interact with students, so that comes as a priority itself. It becomes a priority. So what we as an incubator, I'll take it from where Ramjee said, that funding is something. I generally believe that investors or funder, except for the government, well, I'll not talk about the government, but investors are no philanthrope. They don't want to relish your dream to become entrepreneurs. They need 10x return. So I have been in the incubation space and for a decade and more, 15 years, a technology transfer professional, incubator professional, scanned through more than 7,000 startup ideas, technologies, read so many patents. When I, as an incubator professional, come and a student interact with me, so we have one-to-one session. That's first me talking to them, having a first FIR report is submitted to me. First information comes to me. Then we form a team. So faculties are there and we vet the technology. So my first priority being an incubation professional is what innovation is. And I always see this responsibility for the incubator that we should have a good vetting technology. Vetting of technology is very important. I have seen a lot of startups, student startups, and calls we regularly get, thanks to Telangana government again, they made a dyad of people and we regularly interact. So we are in public, we have our contacts in public and people, we get a call. So first thing I avoid listening from a startup is fund kahan hai, how much fund you are going to give us. Because you have not told me what technology is. So funding is something that comes at last. Or a seed funding that can mobilize it. Writing a black and white presentation doesn't give you all the liberty to ask for funds. There should be something tangible. If you don't invest in your idea, nobody is going to invest in your idea. You're not sure of investing your money, why do I take risk? So there are many other, it's a very subjective to tell mobilizing. Mobilizing is something because we have 13 departments. Well, digital healthcare is top of the list and COVID has taught us. So we look forward, like I'll give you an example in COVID times. We were talking about sensors. Then there was some border issues going on. China has been Atmanirbhar for so many years, and government said that we'll have an import ban. So that time we have a MEMS clean room in our campus. MEMS is microelectronics and mechanical system. It's a clean room for class 100 and 1000. So I told some of the PhD scholars or some whom I interact on an informal basis, why don't we design a good sensor right now? It's a need of the hour. There are a lot of diagnostic companies which will need a MEMS. If you buy a sensor, it's like one of my startup built a robot, a student startup. So he was in Bhopal and I was in Hyderabad. So we met. He said, how will do? I don't have access to laboratory. I told, chalo, make a laboratory for yourself. It was a robotic technology which we were trying to implement. So that time he needed a sensor he couldn't find. So that time I saw a good opportunity wherein we can utilize that MEMS clean room to have sensors and IoT devices to be built. So mobilization again happens. We are sector agnostic right now. Started with digital healthcare is on top of the agenda, and people for tertiary care converting it to digital is something which I see it's people are finding it easier to implement. But there are many other things. So if it comes, we have been meeting online, but now as we have started and students are now in the campus, we will regularly try and meet them. And obviously, when I say that BITS Pilani, again I repeat my statement, it itself is an incubator. All the labs are open. We have a very good, if a startup comes to us, it's not just the incubator laboratories which we have set up, but we treat them as a BITS family. So they can utilize any of the laboratories. Amazon server, again, Amazon gives us a $5,000 cloud credit for it. So that's very important. That reduces your cost of cloud computing for 1 year. And Amazon has many other offers which can be on the second year. So that kind of negotiation we can do. And we say students that it's not just whatever you do, data is the next big thing. So digital healthcare, again, evangelizing, I have passed on the information. I was not here in Hyderabad for past 7-8 days, so couldn't follow up with them, but I have passed it to the student community, and now we have started getting queries on how this public healthcare can happen and how we can utilize the team public healthcare, and we'll love to bring them to our campus and mobilize that fact. So Incubator plays a role in skill development, Incubator plays a role in innovation, prototyping and anything. So whatever facility we can provide them, and as an organization, we can reach out to multiple people. So that's kind of mobilization happens. So it's like, I hope I was to the point, or I was beating around the bush, but anyways, that's how mobilization happens. Nobody can mobilize anybody. It's through like the COVID times, digital healthcare again. Earlier we were, kya hoga? That's not important. But people started, no, we will not visit the doctor because he might be a COVID positive guy. So that kind of, there is a demand-led thing which happens in startup space. After COVID, people start talking about only COVID. Cancer was not on their mind. So there is a plethora of opportunity, and incubator, as I see my responsibility as an incubator professional, to give them ideas, give them a problem statement. Okay, fine. I was in a hospital last night. So I told, okay, fine, I saw it, and we have conceptualized one technology. Shortly, maybe I become an entrepreneur.
Thank you, Prashant. Thank you so much. So now it's a question for all of you. Now we have a lot of innovators. We're talking about the role of incubators. Let's take a case, right? So if somebody has an idea and they are in the digital healthcare domain, if I can request all of us together, because we are an ecosystem, right? It is a completely ecosystem driven, how it takes a village to raise a child. We realize that, in the digital healthcare space and in a startup idea which actually is for the citizens, everybody needs to be involved. So if I can request each of you to say that, a startup which comes with an idea, what can they get from each of the incubators here? And also I'd like to request, if you can add, what is the support that you need from the government here? Or the government-led incubators as well. That would be wonderful. So Visu, if I may start with you.
Okay.
And sorry, one more thing. Dr. John, we haven't heard about the support that the startups can actually get from the CfHE. If we can get a little bit more in that, that would be great. Thank you.
So I will first start with the government support. There is already a program announced, GenCare. IKP is the implementation partner, and this is for the telemedicine, digital health, mobile health startups, but these are not idea stage, slightly advanced. So there is a possibility of support up to 75 startups, and the call will go live next week, and IKP will be very happy to mentor for the application and the program related things. That is where first you can reach. Coming to the second question, what kind of support IKP can offer? As I mentioned about various partners available, not only, so please feel free to pitch your solution, starting just from the technical point, business, clinical partner. We will be very happy. 360-degree support we can offer to anybody coming to us.
Awesome. Thank you. Ramjee, so how do we complement what IKP is? Let's talk about complementing, right? Because we are all here to make sure that the startup idea goes to the citizen.
Yeah, I mean, ideas not only from startups, but even student plus 2 students, and they'll come. And I want to develop this electrochemical sensor based detection for Alzheimer's. But their again career is linked, and their parents, family, and also it's a challenge for us for the student level, school student level also. But otherwise, many other ideas, even companies which are not incubated with us, not even associated with us. Maybe IKP's incubating or VHub's incubating, they take 1 hour or 2 hours of time to get mentorship by AIC-CCMB. I personally did that, and in fact, we have a mini acceleration program partnered with government again, RICH for example. A dozen of startups are engaged with us, and at least half a dozen of them got government connects and as well as clinical connects, where 2 of them, their products are already been getting demonstrated in Apollo kind of thing. So Biota is one example, and again Biota is getting incubated with us because we like that product, and they apply to Nidhi for COVID program, and since AIC-CCMB is contributing some part of seed fund from NST ADB, so we invested in Biota. So I think so kind of one way, even though they are not connected directly with us, but the real happenings are there for them, not only means of funding, but clinical validation by Apollo, and again government support to government. They presented to, I think, CS of state government, I guess. So I think that's where we're trying to help. Even your startup, I want to tell, MedMarvel, which presented, they have a thing here, before they come to our TIDE program, so we have connected to us, then we trained them and kind of guided them. They could be able to get a kind of offer letter of 50 lakhs money, 50 lakh rupees from Atmanirbhar Innovation Challenge program. So again, they rooted out to us, and again they're getting incubated to us. So I think the point here is that if you could able to approach and ask the incubators and the accelerators with a kind of pursuance, proper pursuance. I think you ask and you go on. I think we also have several other startups and many other activities we may also forget. So even half a dozen of or dozen of startups here may be thinking, okay, Ramjee is saying anything, he may not be doing certain things, but if you can pester me and ask me constantly, you need to approach and engage with us. I think certainly you could able to get your solution, maybe not today but tomorrow. So that is one thing I can tell. And secondly, the government side, again, we have an extended wing of all the ministries on the government, central government or state, whatever you say, that is called ISBA, for example. We are partnered with ISBA. So most of the incubators and accelerators which are partnered with ISBA, Indian Steps and Business Association, that is Business Incubator Association, at least 100 plus incubators are there in ISBA, but overall in India, I think 100 plus healthcare, at least digital healthcare addressing incubators and accelerators. That is where I think, not only from the state, but overall in India, we have to leverage how best we can leverage. That's where we have to complement each other for sure, not only for locally, but nationally. That's why Dept comes to us from Bangalore, and again, IKP Eden is there, and also Sign works with us. So now the world is changing. Only thing is that you need to kind of be consistent with what you are asking, and also reliable and suitable to that particular incubator or accelerator, we are there to help you. Thank you.
Just to add another point. So, several people have asked last 2 days, and software as a medical device, what are the regulations, whom we should speak. So, IKP Prime, IKP Technology Transfer Office will be organizing a session, and to what kind of support, what kind of clarification. So, it will not be a webinar kind of thing, but it will be a 3 hours workshop. We will be very happy to take it from there. And coming to the next point, so Ramjee mentioned about various national partners. IKP is a member of International Association for Science Park, IASP. If you have to reach out to any of these global partners, we will be very happy to take it from there.
Thank you so much. Dr. John?
So at IIT Hyderabad, we have a dedicated incubator called Center for Healthcare Entrepreneurship. So the CfHE runs a unique fellowship program. It's a funded fellowship program for an year for anybody who want to be an entrepreneur who is passionate about working in healthcare. So it's an all India wide call for fellows to the CfHE. And we take people from across disciplines. So we have clinicians, designers, engineers, and management professionals working as fellows at CfHE. And it's an open platform where we start from scratch. We bring everybody to a level platform with a set of courses on, like, say, embedded systems, rapid prototyping, anatomy and physiology, and bunch of courses. And then all the fellows undergo rigorous, deep clinical immersions in hospitals, which are our clinical partners. So from the hospitals, they look at observations, they identify the problems that clinicians or the patients or nurses are facing, and come back to the center where we do a looking on the observations and find out the unmet needs, and then we sort of do an impact analysis of all the needs, market and stakeholder analysis, and finally we come up with unmet needs where the fellows would be grouped to team and work on problems, work on this, so that they end of the year they really come up with working prototype of their idea. So there is a need hunting phase of it, and there is a ideation phase. And towards the second phase, we also have packages on IP, regulatory, and how to write a business plan, etc. So it's a 1 year structured curriculum for anybody to be an entrepreneur at CfHE. And apart from that, we also do laterally incubate teams, innovators who have ideas at IIT Hyderabad. So I think that's what IIT can offer, and it's all the resources at IIT, including the rapid prototyping, the machining, fab facilities. Everything is open to anybody in the ecosystem. So anybody who wants to access these facilities, these are all available free of cost or at a minimum consumable charges. So it's open to anybody. All of you, or anybody who wants to work on this can reach to us. Thank you.
So how we support is something what Ramjee said, or all the panel members said. So we are part of a theli. Everybody is crossed with each other. Crossed, not collaborative with each other. I have multiple instances. Past 5 years I have been with BITS. Multiple instances, I am a starter from such incubator. I need to use your facility. I say, drop me a mail. They drop me a mail. I connect them to a particular person. Go, discuss the fact. When I say BITS has a biological science and a pharmacy department. So there are incubators with us, 6, I believe, if I correctly believe. Some of the collaborative animal studies are going on. Clinical research is again one of the sectors we offer for people, and data analytics again. When I work with academia incubator, there are also private incubators. So I see a very good match between what's a lab with a mandate and a startup. So recently we had a collaboration in space technology with a good company wherein we are talking about communication system with the LEO satellites. LEO satellites are satellites which are 400 kilometers above ground. So we incubators are resourceful, we can say, not resourceful. You come, and means like personally my way of working is demand led. Let whenever you come, lay a demand to us. That these are our requirements. We need to judge ourselves if we are competent enough to match up with your demand. So that's how I have, means like, tell me any sector wherein when somebody thinks me, okay fine, this is a startup idea. First thing I do a prior art in my university website, which is the research group which is working in. How good they can have a tangent towards this startup idea, how we can boost it. And when IKP is talking about Biorack big program, Ignition grant. So 5 years, I think so, every year one of the big startup has received that grant. So I generally, for 15 years, I said innovation is very important. May it be expensive, low cost or anything. If it's a premium innovation radical, you can charge a premium on that. But if it is something which has competition, so that would be a competitive value. So how it happens is we concentrate on innovation. How good is there? We don't have a cohort model till date because we are not into giving gyan, because startups, I believe the guy who has conceptualized the idea knows better than what I know. He has searched more than what I have done. So I leave it up to them and say that, okay, fine, we will have a conversation on what is the problem statement, sit around the table, assess that, okay, fine, this innovation would be important. So the next step is to an extent of prototyping. So we have all the facility. Let's talk about additive manufacturing, which plays a very important role in digital healthcare. So additive manufacturing, we have a 3D printer in our campus. Kevlar can be also 3D printed in there. And there are many other things. So that kind of infrastructure is there. There is a research group inside the campus, and we have an informal and formal network around us. So we are connected to everybody. It's not that we have a bunch of mentors in our campus and mentors which we know personally or something, but if you come and tell us this is a mentor, we are not able to reach out to him, but as an organization I can reach out to him. The time lag would be lesser. So that's how I believe that when a startup comes to us, apart from all the government and things we are talking about, grants are most welcome. वापस नहीं करना पड़ता है, ठीक है? So ये
now we need to also do that, and there's a lot of focus on that. So
okay. Anyways, the last point I'll make: give us a demand, and we will try and find a good infrastructure, good research group, and good amount of resourceful people, which will help you to release your trend. And maybe I investor also, and we have done some amount of investments, and we have clubbed investors and startup together. So it's demand led again. Thank you.
Thank you, Prashant. So as you guys know, the common underlying thing in the entire thing is that we all work together. So there's a lot of complementary efforts that are being done by all the wonderful incubators and government at the state and central level. And the last question, and I think this is something that we all keep running into. So a lot of startups, they're doing brilliantly, they've received a grant. But as you know, everything is expedited, everything is accelerated. So how are incubators able to support, incubators such as ourselves, able to support startups which need that gap funding to go on to the next milestone of their product journey? Especially in the digital healthcare, let's say we are talking about everything is monitored, hardware, right? So how are you supporting startups in that? So that is something which will be interesting to know. So maybe Ramjee, Dr. John. Yeah.
So I can tell from the Hyderabad perspective, actually Hyderabad there are 45 incubators and there is a group, and this is well coordinated by TSIC team. And we are planning, like whenever there is a bridge funding requirement, and instead of running around so many incubators, so many programs, so many applications, we will have a common request coming to us. And Telangana, there is a fund called TS fund. They will be happy to co-invest along with the seed funds up to 20% without any questions asked. There is no government, only their government money is there, but there is no government farm. So they have just started, and hopefully we will be able to keep this running. This was discussed in the last incubator meeting, and we are planning to formalize how this need to be done. And maybe anybody want to add something
from the academic perspective, Dr. if you can.
So I think we do the same thing. Like we have a seed fund of about 25 lakhs, up to 25 lakhs for the incubatees, And many times what we see is that the incubators do get a lot of grants, so that they keep this as a bank. So they don't cash it in the beginning, so that at some point whenever they are really short of money, they use this mainly for their product scaling up activities, etc. So I think it's very good to know the state initiative. So I think many of the startups would be looking at that.
I mean, as I mentioned to you already, we have the TIDE program. That is one way. We need a small funding of 4 lakhs, 7 lakhs, even 20 lakhs or something like that. But we created a pipeline of, starting our own incubation funding, our incubation revenue. We have a very small revenue because we entered the game just 3.5 years before. We're not that surplus like other parks here. So what we are doing is that, okay, we spend on behalf of you, okay, part of the money, maybe some 50,000, 1 lakh or small money. This is the actual gap that they really require. Being academic innovators, for example, before they actually tap into the real grants, because they have to show some data, right? So COVID times actually we started that, some 3-4 companies we use that 2 lakhs kind of money and etc. So then they would be having the data, then they got the BIG grant of 50 lakhs. And they're also raising about some 100 to 100K. So this is the kind of pipeline. So what exactly you need on that spot, if you can actually able to tell us somewhere or the other, I think, we'll be adjusting and trying to help you if your solution is really kind of getting onto the track for next 6 months, I think. That's why we are doing that.
Thank you so much. So now, given the paucity of time, we'll open up audience questions. Sorry? Audience? Yeah, please. Very quickly though, because we have, I think, a lot of questions given that everybody's
I'll just tell you what BITS does. All the programs run by state government or central government, we make you ready to grab that grant. So that's how our incubation center works. You come to us, and then we call Vishu again. He's an expert into developing the proposal. So I believe a mentor, IKP as an institution. So how good the language is very important. You might know universal things, but the language, how you write the proposal, the propositions, and things like that. So that's also a very important aspect. So how we are important, startups should understand, and you should choose the right incubator. If you are a pharmaceutical based, CCMB would be a good place. BITS would be a good place. We rank a top 5 pharmacy department in the country. So you have to choose right and come with a good demand, and all the programs are open to all the incubators. We are some certification happens which is done through the incubator. So that all things are there, and it's a collaborative approach. And Telangana, it's whole of a city approach, as Jay Ranjan Garu says. Everybody is collaborated with each other, and we want to help you with whatsoever can happen. Thank you.
Thank you so much. Now we'll take 2 questions. One request is that please ask the question, and please also mention the panelists you'd like to address the question to. Thank you.
My question is open to all the panelists, but I would like to direct it to Dept. I think all of us will agree that along with doctors, nurses also play a major role in healthcare, and they make up for the backbone of the healthcare system. So in the recent case, what I see is many doctors are willing to try their hands on management roles and entrepreneurship, but I don't see any nurses doing the same. So my question is there any plan in the pipeline at we have, or what is your take on this?
That's a very interesting question, because this is something that we've just discussed with the Commissioner of Health and Family Welfare. So we have a very brilliant, dynamic officer who is the Commissioner for Health and Family Welfare, and she looks at the healthcare system starting with ASHAs and ANMs. So that is one of the key conversations we've already started. While we've not curated a program yet, we want them also to understand that the service or the work that they're doing is the backbone of the entire healthcare system, right? So what we started doing is actually talking to them and structuring their work a little bit more efficiently, and also showcasing that, how they are, they are creating kind of like a long-term perspective for them also. That is the first thing we are doing. The second thing we are actually doing is, while we don't have a program for them to think like innovators or entrepreneurs, we are actually creating an open platform. They can come in and talk about the concerns that they have, or the gaps that they see, which can actually become problem statements that can then be rolled out to the a startup ecosystem. That is the thing that we're actually doing. But with Asha's A&Ms, okay, nurses are a little bit higher up on the value chain, right? So yeah, that
Can I
is
just add, I think, we have another program, many of you may be knowing, anybody under 35 years of age, if not startups, nurses, I think good opportunity, because they know the bedside problems and the realistic problems. So I think, the SPURS program of BIRAC, where AIC-CCMB and IKP are the SPURS partners. So we actually kind of pre-immerse them at the hospitals and whatever, depending on the theme. Like, we are having two themes, aging and health and maternal and child health. So I think this is a good platform for them. They know the realistic issues at the bedside and ground level. So maybe I think that is one way they can actually approach us to get into.
Yeah, please approach VM only through any of these guys, because honestly, while we can actually scale it to a state as a whole concept, the validation and everything, we do rely on them. The reason is, it's not that any of the state incubators cannot get the best resources, right? But that is not a startup needs an ecosystem, not a central point. So we are working on that approach. So we rely heavily on, validation from Visu and Ramjee and Prashant and Dr. John, CfHE, to make sure that, we can say that, yes, this works, and let's just go full scale and full steam. Yeah.
I just want to add, IKP has another program called IKP Growth Labs, where along with 20 lakhs funding from IKP, we will also take you to the site for the immersion, to the manufacturer, whoever is the requiring partner, to take it to the next level. So as Deepthi mentioned, so we all will be very happy to help you. And the details are there to contact us.
Yeah.
So any next questions?
Yeah. First of all, thank you very much and congratulations for this effort. I mean, as a mature startup, I could say that these guys were facilitator first, now friends more. So my question is very specific. So we see there is a lot of activity happening at the early stage, where is an innovator comes in with an idea, and then the incubator support them to establish the startups, get funding, and moving forward. I want to know what are the efforts that now the incubation system, I would say now today India's incubation system is mature as that we can compete to Silicon Valley as well. What are the steps that we are taking for maturity of the startups moving forward? I mean, we have proved the proof of concept, the product is close to market. What are, as incubators, we can do to facilitate them to get to the marketplace, address the marketplace and get better revenues? Part A, and part B, what are we doing for them to raise VC funding and reach up to PE funding level?
Yeah, this is the biggest problem that many of the incubators got realized through these past 2 years. I think incubators now trying to act as not 100% accelerators, but trying to actually do some of the mini acceleration programs with some of the acceleration agencies. I mean, we adapted one program, we got some small CSR fund of about $250,000, close to $500,000 actually, but what we are doing that, okay, why can't, again, the same question arises that what's next? So that's why you rightly mentioned about that, the market access, and also productization, regulatory, validation, whatever. So we designed a small 4 to 6 months program, and we are doing in a cohort level. So I think, this is the high time for all incubators and of course, other accelerators also have co-working spaces who are trying to do something for the startups. They need to kind of tighten up their laces to address these issues. A lot of difference, a lot of challenges that are involved. So I think, that way we are trying to solve and address, kind of this problem of, what is next, okay? So I think others also may be having some other.
I think it's the last, Yeah, sorry. After Prashant answers the
.com till date. So that genesis is, so startup should understand it's not in the right. You come as a pre-incubator, then go for the incubation. So again, it's not just funding agencies, government, full center come to us. And again, the demand in a cohort model or any model, we will analyze or we may suggest if you are open to listening to us, because I see a lot of startup after one stage stop listening. So there are issues on that part also. So that will happen. So you should be a bit open with your ideas to discuss. Thank you.
Thank you so much. I think we'll take the last question and we'll close because I think we are way over time, an hour over time. Thank you.
While the mic is going there, I will just extend the answer.
Yeah.
So I think Incubator should work with agencies like AGNI, Social Alpha, India Health Fund. So where the solution can be provided at a scale, answering your thing, to take it to the market and to take it to the agencies that can help. I hope the mic reached.
Yeah, I represent Parishodhana Technologies in healthcare space, not digital. But one common challenge for most of the health-related innovations is health being a state subject. If the initial trials are done, let's say in Telangana, and if you want to go implement this product in Andhra Pradesh, Karnataka or Maharashtra, we'll have to go through the same cycle of trials. Is there any collaborative effort across the nation where one state's systematic, ethically approved observational study will be accepted across the country, and that will automatically pave the way for market and commercialization? That's the biggest challenge. I think this answer can be given by Sharath actually. So I think I would like to comment on something like this, not now, maybe in the speech. Yeah. So he's going to speak
exactly on this
sometime.
topic. Yeah. So yeah, that'll be good. So it is one of the, as we know, the underlying the questions which are the, yes, we have one lady also ask a question, and I need to make sure that she does ask the question. Women entrepreneurs, yes, obviously. Last question and brief answers, please.
Hi, I'm Rupal Mehta from MODERATOR, and more than a question, I want to take this opportunity to thank all the panelists here. We are the alumni of WeHave, and they have really tremendously contributed in our journey and introduced us to Dr. Ramjee at a very crucial point in our journey where he helped us to get his mentorship helped us to get the grants and the entire ecosystem. We're very thankful to him. So even the questions, most of them have raised, I've already raised my questions personally about going from the prototype level to the product level. Doing the pilot is the toughest journey in the entrepreneurial segment for all of us. And that's the area we seek more help. So,
thank you.
Thank you so much, each of you.
Thank you. So to summarize, so we can actually take, I think we are way over time, we'll be happy to answer the question off stage. So to summarize, as you are aware, so it's a very complementary ecosystem that we've built here. If you have an idea and you want to explore, please go to Prashant. If you want to actually go through a structured program as a student, or you want to make sure you learn the ropes of entrepreneurship, please do apply to the CfHE. And for everything else, I think IVP and Ramjee, AIC-CCMB are the backbone of a lot of the brilliant name that Hyderabad has the pharma capital of India. And please do approach any of us for taking any kind of a startup idea in course correction and making it a viable commercial product which can actually serve the citizens in the digital healthcare space. We're all here, and thank you so much for the opportunity, and we look forward to engaging with all of you off stage. So thank you so much, Dr. John, Prashant, Dr. Pallela, and also Visu. Thank you so much.
What a wonderful panel discussion it was. A huge round of applause for each one of them. IFCAI onto the dais. With a huge round of applause, everyone. Mentor to Ms. Deepthi Ravula, CEO WeHave. Everyone. Thank you. Thank you. May I now worship IIT Hyderabad. Thank you everyone. Incubation Center of CCMB Hyderabad. Head Technology Business Incubator at Pilani, Hyderabad campus.